Hey everyone, in this video I just quickly wanted to go over the rotator cuff anatomy. I noticed that there were quite a bit of searches and questions regarding the rotator cuff muscle. So just wanted to go over some basic pictures and images to share with you the function as well as the anatomy of your rotator cuff muscle. As you can see, we have two images here side by side. This is an image from the front of your shoulder, and this is an image from the back of your shoulders, so you can keep that in mind. So from the front of the shoulder, from the inside of the shoulder blade muscle, there's a thick rotator cuff muscle called your subscapularis, and it's this muscle right here. This muscle attaches to sort of the outside of the your arm bone called your humerus, and this muscle is responsible for internally rotating or the inward turning motion of your arm, and it's called an internal rotator muscle. Just as a quick recap, your four rotator cuff muscles are your supraspinatus, subscapularis, teres minor, and infraspinatus muscle. Other structures that where the rotator cuff gets injured is your clavicle, the subacromial bursa, and your biceps tendons, which sometimes can get impinged. Further anatomy features to look at here: you got your subscapularis muscles, as stated. You have your supraspinatus, which runs sort of from the back of the shoulder blade or the top of the shoulder blade underneath the clavicle, and it attaches to the front of the humerus head. This muscle is responsible mainly for internally rotating your arm or the inward turning motion. Then you've got the teres minor muscle, which is running looking at the back of your shoulder. It's the distal end of your scapula or your shoulder blade. It runs underneath the other muscle groups and attaches sort of on the inner side of the humerus head, also responsible for the inward turning or internal rotation of your shoulder. And then your infraspinatus muscle is sort of the 2/3 of the bottom of the shoulder blade. You can see it quite clearly on this image right here. Pretty much captures most of the back of the shoulder blade muscle, attaches to the back of the or it wraps around to the front of the humerus, and also responsible for internally rotating your shoulder. Here's some different images with the muscles broken down. This is the infraspinatus muscle, which we just went over right here, and you can see clearly how it's got most of 2/3 of the bottom half of the scapula covered, and it's running towards and wrapping around the top part of your humerus, and responsible for internally rotating your shoulder joint. Then you've got the supraspinatus, which runs sort of from the top of the scapula, and this muscle again wraps sort of on the front of the shoulder, responsible for externally rotating your shoulder. And I apologize, I said internal rotation on infraspinatus. It's an external rotator. Then we've got the subscapularis muscle looking here at the front of this image. It's running from the inside of the shoulder blade, attaches to the front of the humerus head, and it internally rotates your shoulder joint. And then lastly, you got the teres minor muscle, which is sort of on the lateral border of your scapula, wraps around to the front of the humerus head, and it also externally rotates your shoulder joint. So you might be wondering which rotator cuff muscles tears the easiest. That answer would be your supraspinatus muscle. It seems like most tension and strain is exerted on this muscle when you perform different lifting movements, and since it's not a very thick muscle compared to the others, if I could just quickly show you, and then we've got the only other small muscle would be the teres minor, but the supraspinatus is the smaller of the four rotator cuff muscles and gets hurt the easiest. So a good way to avoid injuries to your rotator cuff muscles would be to really focus on your posture, as well as improving the muscle structures around your shoulder joint, including the rotator cuff muscles. That's just a short video to cover basic anatomy of your rotator cuff. I hope it was helpful. If you like the video, hit the like button below, or even subscribe to our channel. Greatly appreciated. I wanted to mention that if you are having shoulder pain or issues, at our website physicaltherapytv.com, we offer just a free course and free tips on how to eliminate rotator cuff tendonitis and shoulder pain. So feel free to check that out. I'm going to leave a link in the description below. Thanks for watching. Take care.